What's going on, people? So we are back again with another video. So today I'm going to be talking about knee pain. So this is going to be specifically for people who work out. Like I said, I'm not a physical therapist or a chiropractor, so take this, just as advice. But for people who don't work out and have knee pain, it would be better to go to your doctor to see what to do, because it can be caused by something else. But this is for people who are working out. So back to what I was saying. So when it comes to pain, you got to understand that there's different types, because sometimes it can be a pinched nerve. Sometimes it can be the actual bone/tendon, or it can be a muscle around the knee that can be causing the pain. So sometimes you have to figure out what's causing it or what type of pain it is. And I know it can be a little bit hard to describe it, because there have been times where I've worked out and I've had pains and I'm thinking that it's in like my bone and my ligament, and it was just in my muscle. Even the neck pain that I have sometimes, every now and then when I sleep the wrong way, I'm thinking it's in the bone, but it's really like just my muscle and just a really, really sore, tight muscle. But you need to understand that, because that can tell you what to do moving forward. Because if it's in the muscle, that can be possibly that you didn't warm up the right way, and the muscle could just be strained. And like I said, if it's a little bit deeper, that can be an actual injury. So you want to figure out what actually, is the culprit, what's the actual issue that's causing you the problem. So I'm going to give you some tips. So if you're having knee pain and you know that it's the actual knee itself, like I said, the ligament, it can be from what you're doing. So go back, retrace your steps, see what workouts you're doing. So for example, you're doing squats, you got to make sure that you're doing them correctly. There was a time where I was doing wall sits, and it was kind of during the start of the pandemic. I would do 30 seconds, and then I would bump it up to about a minute and a half to 2 minutes. And over time, I did start noticing pain. And for me, I know it was because I didn't properly warm up. So I started to warm up a little bit later. When I started to do them more, I started to make sure that I was warming up. And that I was comfortable, because I hadn't trained legs before that as often. Of course, I did my bigger compound movements, but I didn't specifically dedicate like a day or just time in the workout to doing leg related stuff. So that's why I started feeling the pain, because I wasn't used to it. So I started doing warm-ups and the pain started to go away. Another thing could be progressing a little too quickly. That's another really, really huge thing that a lot of people do. They don't understand their limits. So, and like I said, this just comes from not working out as much. I had times where I was working out 5 days a week when I first started, like my very first few months working out, and just times where I just had more time, especially when I was away at school, and I wasn't working every day of the week. I just had more time to work out, and you're able to see, how your body reacts to different things and different workouts. So you have a lot of people that come into the gym later. They end up starting to work out like in their 20s, a little bit later, and they had possibly never played sports. And when you do that, typically you don't understand your body fully. And then of course it's easy for you to get injured, but you don't know what your limits are. So for me, I know that I can't increase weight weekly. I typically will increase it every 2 weeks. And then what I'll do in between it is every week maybe I'll add like a couple reps if I'm able to. But that's a really, really important thing. And sometimes you stack on too much weight, you do too much, and then it strains the joint because you're not strong enough to handle it. Because basically the bone, not the bone, but as the muscle gets stronger, the muscle is pretty much handling the weight, and that protects your joints. But if your muscle isn't strong enough, your joints aren't protected, because you're not, your muscles aren't strong enough to resist it, and then it adds all the weight onto the joint. So that's why ego lifting is so bad. That's why people get injured when they ego lift, and they try to lift too much weight. You're really, really damaging your joints, because the muscles aren't strong enough to resist that weight, and thus all of that stress is going on to your joints. So for me, a time where I did this was, I think it was when I think it was when I was doing curls, but basically I was trying to target the inside of my bicep to get them wider. And eventually I did, but when I had first started, of course, when we're targeting the inside of the bicep, we do curls where our arms are kind of, in an outer way, because that way it pretty much just puts the tension on the inside of the bicep. And then, of course, when you have your arms in, like if you're doing hammer curls, that targets the outside, the brachialis. So that's why back to what I was saying with the curls. That's a very, very sensitive movement, and you're not in a very, very, I would say, comfortable or normal position, because we don't do this in life. We don't carry stuff like this. It's not normal. So you have to be very, very careful. And what I was doing is I was pretty much using high weight when I shouldn't have been. So I think I started doing that. I was using like 20-pound weights. And I started to feel a lot of the pain. And they consider it tennis elbow because the pain is right here. I guess that's because tennis players, they have their hand in a similar position. But I was feeling a ton of that pain. So I would be in class, I would be feeling all this pain right here. And that's probably why to this day, if you know me, you hang out with me, I do this a lot. And you hear the crack. And people ask why I do that. And I'm like, it's probably because of the injury. So that's why I haven't worked out in like an entire year. I think the last time I worked out was last February. So just trying to heal from injuries. But yeah, that's why I do that crack thing. But the point was, like I said, I was dealing with a lot of pain, and a huge reason, like I said before, was because the weight was a little too high. Not a little bit, but extremely too high. So eventually what I did was I dropped it down to, and this was when I was still working out, so I think I dropped it down to like 15 pounds and, did my thing. And I started to notice the pain went away. Of course, fluid's going to build up. That's why I'm always, cracking it. Fluid builds up. But it wasn't extreme pain like it was before, where I would just be relaxing and I'm just holding my arm like, ow, like my arm is just, it's hurting right under there. So that's the importance of, like I said, understanding some of the culprits. Another culprit can be a lack of support. So that's why sometimes people put on sleeves. So because this is knees, like I said, maybe put on a knee sleeve, like the ones that a lot of powerlifters use. And it just adds some support. It's similar to wrist straps, just adds that extra support to stabilize the knee and keep it from moving around too much. So you want to try to put that on and see how it works. See if it helps you. So that's all I got for knee pain. Try that and see how it works.